Hello and welcome to this episode of AI Med Talks. My name's Alexis May, and today I'm really pleased to be joined by Craig Rhodes of NVIDIA. Craig, thanks so much for joining us. Just to kick things off, you just give us a little bit of a background about you, please?
So my name's Craig Rhodes. I lead health and life sciences for NVIDIA in Europe, Middle East and Africa. So my main focus is working with large lighthouse organisations in healthcare, research and the pharmaceutical industry.
Thanks, Craig, and thanks for joining us today. As you know, through AI Med Talks, we are looking in particular at the response of the data science community across the world with regard to coronavirus and the activity that's going on. Tell us, what are NVIDIA doing to leverage the significant reach strength that you have in response to this pandemic?
Yeah, thank you. So I think first of all, congratulations to the first line staff. What amazing jobs they're doing. So NVIDIA is working in a number of different areas. We've had amazing support from our senior management. Specifically, we are doing a lot of work in genomics, in medical imaging, as well as working both in the research and the pharmaceutical and really at the front of care as well, at the point of care. So if we take the point of care, there's a number of initiatives that are going on around X-ray and CT scan and being able to apply AI to those and being able to support the decision-making process with those clinical teams, really to try and triage out, the patients, the non-urgent versus the urgent patients with obviously the enormous volumes that they're seeing. Then in the research sector, we have recently acquired an organization called Parabricks. They have got some software that accelerates GATK4, so for sequencing. So this, again, very, very useful for looking at population studies. So when we bring all of this data together to identify why did some people react in some ways, some people didn't. That's a very, very good tool, very, very well optimized, over 30x performance improvements. And then within the pharmaceutical industry, we're also out there trying to support them in the drug discovery domain, providing our software and our hardware to really try and accelerate a lot of the workflows that they're trying to use, a lot of the applications that they're using, so that they can get to decisions much faster, much quicker.
Thanks, Craig. And I mean, it's really interesting to talk to someone whose remit sort of encompasses all of those it's the full kind of value chain, I suppose, of healthcare. Looking forward to, I suppose it's sensible to look forward now, try and learn lessons that we can apply now, but also for the future. There's a lot of talk about how AI is coming to the fore in this crisis, but if we think forward to the next pandemic, and hopefully that's not anytime soon, how do you see the role of AI in the next 3 to 5 years across that piece in preparing us adequately for what might come?
Yeah, so I think it's a really good question. I think what we failed to do is really join up the healthcare systems well. Even within the NHS, we are still struggling to be able to share valuable data between organisations that they can come to a better decision, a much faster decision about what to do with this particular patient, or look at patients across regions, across countries, and look at where the spread is, how fast the spread is carrying on, where to focus your attention, where not to focus your attention. So I think that whole, and we've been talking about this a long time, interoperability between clinical systems, healthcare organisations, certainly within the UK, but then you look at Europe and how do we go across boundaries? How do we see how the transmission of a disease is moving across from one area to another area so that we can really focus down on that? So I think possibly not just AI related, but just connecting up these systems together is massively important. And something we've been talking about for 20 plus years. So this is something that we've really got to get a hold of, and hopefully something positive to come out of the COVID-19 pandemic that we're seeing, which is completely awful. But we need to kind of prioritize getting these systems sorted out. I think AI can really play a role in that, whether it's the natural language data, the unstructured, structured data coming out of the clinical systems, whether it's those medical images, whether it's that sequencing data. And, you know, when you bring all that together, you start becoming, you know, a real kind of precision medicine world. And again, we've had these words going around many, many times, but we're really failing to do that as a, you know, as a country or countries or as the world now that we see. So the other thing that we've got to see is we've got to stop seeing ourselves as, you know, a region or a country. We are part of the world, and these pandemics don't care about borders and boundaries. So these are going to be more important to be able to take data and federate that data across, whether we're moving the data or moving the knowledge within that data across from one organization to another without the consideration that this might be, you know, another country. We, of course, have to comply to the ethics and the governance around that data, ensuring that the patient is not at risk and we have consent of that data. But we really need to reapproach what we've been doing previously, which is really thinking in silos, thinking in clinical silos, research silos, and pharma silos. These worlds have got to come together. Otherwise, this is just going to keep on happening.
Thanks, Craig. I think you've managed to sum up really concisely there some of the things that we knew that we needed to do. But as you said, that, you know, there's a real burning platform now, isn't there? And you know, let's hope, you know, there are positives to take out of this situation, and if it enables us to move on with some of those initiatives, then you know, that's definitely a good thing. Craig, we're going to wrap things up there. Thank you so much for joining us today. It's been great to talk to you, and thank you for joining us as well. You can find all our catalogue of AI Med talks at ai-med.io. Please make sure to like, share, subscribe, as we try and spread the word about the great work that's going on in our community.